All right, so thank you for the global update in numbers. I now turn to Kim Yeon-seung for more on the latest developments with regard to the pandemic here on the local front. Yeon-seung, welcome.
Thank you for having me.
Right, so as I mentioned earlier, Korea has topped the 500 mark with regard to the number of critically ill patients. Let's start with that.
Right, so health authorities did say that one of the warning signs that shows that the nation healthcare system is reaching its limit is if there were more than 500 critical patients. And on Wednesday, the country has surpassed that level. Critical cases are really taking a toll on the capital city's intensive care capacity, with more than 80% of ICU beds in this whole city being filled. That's up almost 2 percentage points from the day before. Beds are quickly filling up on a nationwide scale as well, with more than 60% of the beds occupied.
Right. Again then, Yeon-seung, as you've been saying throughout this week, I suppose authorities are turning to booster shots to address the situation.
Right, so authorities today had made a decision that would speed up booster shots for almost 14 million people nationwide. They're shortening the interval between primary and booster vaccine doses. The new plan recommends people in their 60s and over to get their extra jab at least 4 months after their final doses, and people in their 50s to get theirs after 5 months. Previously, authorities recommended people get top-up shots 6 months after being fully vaccinated, so the shots are being fast-tracked by 1 to 2 months. By doing so, health authorities are hoping to tackle the growing number of severe infections among the elderly and those with fading immunity. Along the lines of this decision, something really interesting came up during the briefing on Tuesday. Take a listen.
While there are only 8% of people in their 60s and over who are not fully vaccinated, they made up 61.7% of the total 452 deaths from October 3rd to November 6th.
So to put this in other words, unvaccinated seniors only make up around 3% of the country's population, but more than 60% of COVID-19 related deaths. This really goes to show how important vaccine protection is in keeping the elderly safe from infections and serious illnesses that could have fatal consequences.
Right, I see. Meanwhile, Yeon-seung, I hear there's been some advance in hopes of offering COVID-19 treatment pills to people in less privileged countries as well.
Right, exactly. So Pfizer has signed a deal that will allow generic versions of their COVID-19 pills named Paxlovid to be licensed to 95 low to middle income countries. The company is also waiving the royalty fee for these countries. Although the drug has not yet been distributed to the public as of yet, it has shown promising results in clinical trials and is seen as a potential game changer. The company is hoping that this drug will play a critical role in quelling the pandemic and saving lives in those lower income countries where there are more than half of the world's population. The drug is expected to be priced at around $700 but in lower income countries, that price tag will most likely be brought down. Pfizer's move, however, has been met with some criticism that some of the hardest hit countries like Russia, Turkey, and Brazil are not included in the deal.
I see. All right, Yeon-seung, thank you for now, but do stay behind for the extended talk.